Hello everyone, I'm Mike Jones and I'm back here for our next in our MET 101 ebook tip series, tip number 40. Now, tip number 40 is rather interesting. When we started the NES back in 1994, probably somewhere in the late 90s, early 2000s, we started having a number of our MESs that started going into doctors' offices, chiropractors' offices, and physical therapist offices, working in those facilities, providing exercise services to those clients. So if you don't mind, let me talk a little bit about how that process works. And this tip specifically asks about the concept of percentages to charge. So if you would, let me read through it and we'll talk about it when I'm done. Tip number 40, what percentage should I charge for services billed by the MD or RPT? So, well, this concept of a medical professional billing for your services puts you on a very, very slippery slope. Let me say this first. If you're providing services in a medical professional's office or offices and they are billing for your services, the only way billing can be done is if they are providing direct supervision to you as an employee. If you're working with your own clients, but the medical professional is billing for your services, this becomes a very sticky situation. This moves into the arena of insurance fraud. Because, folks, if you're seeing a client at their home and the doctor or therapist or chiropractor is billing for it and they're not there and they're not supervising you, what they're essentially saying is, I saw this patient and here's my license number and I'm going to bill for the services. If they are not providing direct supervision over what you're doing, as in you're on the premises where they are, and they may not be right there in the room with you, but they are nearby that you can ask a question if a problem comes up, then folks, that is not appropriate. That is insurance fraud. With that, let me continue. Now, on the other hand, if you are working for a chiropractor or a physical therapy facility as an employee, the physical therapist or chiropractor can bill for those services. Now, one thing to also point out, if you're working in a physical therapy clinic, mindful of the fact that now Medicare guidelines may limit the services you may provide as a non-licensed professional. Make sure you educate yourself on the Medicare guidelines, and I certainly know the physical therapist that you're working for will certainly educate you on those. Now, let me continue. If you're providing MET services in a medical facility to clients not receiving treatment and the insurance carrier is not billed, then I recommend that you do a 50-50 split. As in, clients are coming in, they've been discharged from physical therapy, but you're now providing an exercise program. The client realizes it's just an exercise program. There's no therapy or anything along those lines that the medical provider is trying to convey to the client. Then certainly, I would recommend a 50-50 split. If they're charging $100, I would ask as a medical exercise professional for 50 of those dollars, and the medical facility gets the other 50. Because this is a cash and carry situation, there's no need for billing the insurance carrier. So whatever the fees are paid by the client, you take a 50% take. Again, I cannot tell you how important it is that you understand the concept of direct supervision, especially if you're working in a physician's office and insurances are being billed. Folks, that is vitally important. We've had a number of our NESs that have gotten into situations. No one's gotten in any trouble because we've advised them to leave those type of situations where you are a contractor, where you're seeing clients in that facility, but that medical professional is not there, or you're seeing individuals in their homes and that medical professional is not on site with you and they're billing for those services. Please, please be very careful of those situations. Now, there's one thing I need to clarify here. If you're working in a cardiologist's office and you're providing cardiac rehab, that's a different story. But there should be a cardiac rehab nurse or a physician supervisor. This constitutes direct supervision and is appropriate for cardiac rehab. But folks, please remember, if you're doing any type of cardiac rehab, working in a cardiac rehab office, if you're an exercise physiologist and you're appropriately certified to do that, great. But medical exercise training was never designed to be used in lieu of or to provide services for those that needed cardiac rehab. The cardiac rehab client needs cardiac rehab services that are supervised by a appropriately trained cardiac rehab nurse. They need telemetry. They may need a crash cart along with all the medications. Because please remember, these individuals are in a very important situation, and they're in a tenuous situation in that they've had heart attacks or they have other complicated cardiovascular issues. That's not within the scope of the medical exercise specialist. That's why we don't teach cardiac rehab in any of our MES or PRCS courses, because there needs to be a cardiac rehab nurse supervising that can read the telemetry, has the appropriate medications if a client should have a problem. So with that, please make sure you go to MET101ebook.com, download your free copy, and please join us for tip number 41. Take care.